we are seeing this disease getting younger and younger. What I mean by this is historically, it was thought that heart disease is something we'll get at the old age when you reach after 65 or 70. But lately, we have seen, especially in the ER, as a physician, I see a lot of young people coming in with heart attacks, which is kind of a little surprise. So what's going on? What's the reason behind this?
Well, I mean, a lot of this, as we've sort of talked about recently, I think stems from a lifestyle. Things have become very convenient. We have seen, how are we already seeing higher levels of blood pressure in a patient who's less than 50, who's in the 30s, 40s? We're already seeing that. We're seeing much more bigger waist circumferences. We're seeing much more bigger BMIs. Now, you have to understand insulin resistance goes high. Atherosclerosis is when you give all these risk factors to the artery. Mind you, these arteries are 2 to 3 millimeters. Can you show me in your finger what 2 to 3 millimeters is? That's how small the artery is. So atherosclerosis starts and accelerates when you have all this. Not to mention, if you have chronic kidney disease and you start smoking, right? Smoking is one of the major established risk factors that potentiates all of this stuff. So what we're seeing is, it's also very convenient now for a lot of younger folks to walk in the emergency room, right? Not necessarily each one of these younger patients are going to have established coronary artery disease, but they do come in for chest pain. Now, exactly. Chest pain, as you know, as an ER physician, it's a very loosely used word, right? It not necessarily mean actual true coronary artery disease. And not to mention the fact, which is a very sensitive topic, and it's about young people using illicit substances. Mm-hmm. Unfortunately, the trend has become, which I hope at some point we can find some kind of preventive measure. They're using over-the-counter medications, stuff like younger people are having sudden cardiac death. There's been use of these counterfeit fentanyl and other laced substances, which unfortunately is putting a lot of toll, not just on the young population, seeing a surge on the Muslim population as well. And this is something that I think as adults we need to talk about.
Yeah,